Hi, welcome to our session on how startups can successfully market and develop partnerships with managed care organizations. I'm Steve Ramsland. I'm Solome Tibibu's co-author of Rethink Behavioral Health Innovation, which is a must-read newsletter on digital behavioral health. I hope you're all subscribers. And I'm founder and CEO of Catalyst Health Resources, which is a venture services firm. My team and I are all former executives of managed care organizations or behavioral health provider organizations, and we help digital behavioral health startups with their go-to-market efforts. A big part of our work is helping our clients to develop value-based partnerships with health plans. That's what we're going to be talking about today. Two of those portfolio companies are Rhea Health and Meru Health, and I'm joined today by their CEOs, Tom Nix of Rhea and Kristian Ranta of Meru. Tom, can you get us rolling by telling our audience a little bit about Rhea Health?
Yeah, hi everybody, I'm Tom Nix. I'm the CEO of Rhea Health.
Rhea Health is a technology-enabled telehealth solution that is focused on
change the relationship with alcohol. We're bringing an evidence-based program that includes medication-assisted treatment, digital therapeutics, coaching, and peer support in a totally physician-managed approach to treating alcohol use disorder through telehealth.
Kristian, how about you?
Hey everyone, I'm Kristian, the CEO and founder of Meru Health, and we are a tech-enabled telehealth practice and a digital therapeutic for depression, anxiety, burnout. And yeah, we have licensed therapists on staff, and we use a digital program plus a wearable biofeedback device to help people heal and get better from depression, anxiety, and yeah, that's me. Thanks.
Good. Yeah, so you'll all hear more about what these two great companies are doing, both in terms of how they market to managed care and how they're addressing COVID and other kinds of needs. So you've both had great success so far in developing contracts with major managed care companies. Tom, Rhea is now in network with Anthem and Optum and for their national membership, and there are a couple others in the pipeline. Anything you can tell us today?
Yeah, we've just finalized an agreement with Beacon Health Options, and we're really excited to have the opportunity to serve their members and work with them collectively on focusing on the broader issues of mental health, but in particular substance use disorder. Given the COVID crisis, everyone and every employer is concerned about the increase in people dealing with trauma, and so this has been a great opportunity to have that chance to work with them.
That's great. They're a great company to work with, one of the ones I used to work at myself, so I'm glad that we've got that contract in place. Kristian, how about you? What's happening with Meru and your contracting efforts?
Yeah, so recently we launched with Cigna, and we're now initially in 3 states, California, Colorado, and Arizona, and expanding into more states in the coming few months. So we're in network, fully insured, self-insured, so for their total behavioral health offering. And yeah, definitely seconding Tom there, we're seeing a lot of struggle. Unfortunately, people are really struggling with the COVID stuff and with the isolation and everything. So we're very glad and grateful that we're being able to now reach out to people and help people out there. So.
Great. So whenever I get an initial call from a startup CEO that wants to develop managed care partnerships, I try to let them know that even with our deep relationships, both myself and my team, with health plans and knowing how to get things done with those health plans, this isn't a quick process. Health plans, one of the things I say is health plans don't work on startup time. But those startups that do come to them with the right value proposition, the right planning, the right messaging, have the right outcomes data, and are doing the right kind of outreach to MCOs are successful in getting contracts. What have you found to work well for you? And what have you found to be some of the barriers or MCO preconceived notions that you've had to kind of overcome along the way in your journeys to getting these contracts? Kristian, you want to start?
Yeah, sure. So, yeah, it's been a journey. I mean, it definitely takes some time. And the quickest health plan partnership with a regional health plan, that was for us, it was kind of altogether around like a 9-month process, which has been pretty fast. But then most of our collaborations are like 12 to, I don't know, even up to 18 months. in preparation and then kind of to a launch and so on. But COVID for us now seemed to accelerate things quite a lot with a couple of health plans, and that's been something we didn't expect, but it's been a positive change for a lot of different stakeholders. I think a couple of things that we've seen, be important components is that we've done extensive research and publications on the clinical effectiveness or efficacy, and also the utilization and engagement. So those things have been really important to drive things to actually like partnerships and pilots. So I think that's maybe one of the most important things. And then some of the challenges we faced have been like coding and billing, like the fee schedules. Like how do we fit this kind of a new thing, such as digital therapeutics, but also like this telehealth supported digital therapeutics kind of a realm? How do you actually fit it into the existing codes? So that's been a kind of a great challenge to have, and I've been doing some bundle payment patchwork and all sorts of cool kind of explorations, and that's seems to work pretty well. So it's possible.
Yeah, I mean that's one of the biggest challenges I find is that your companies like yours are not kind of the first generation digital apps that contracted with payers as vendors, but you're not traditional brick and mortar providers either. So the network contracting process and the claims payment mechanisms and so on were really not designed for these kind of new innovations. So one of the other things I always say to our clients is that we're going to spend as much time with the payers as with you in terms of helping them to figure out how to pay for these new innovations. Tom, how about you? What's your experience been like with this?
My experience maps really closely to what Kristian shared. Everything from the showing up with data, being able to show people kind of really good clinically valid outcomes that impact the lives of their members, and the opportunity to kind of think through the billing solution that makes the most sense, not only for the health plan but for their members and for us, the provider. The one thing that Kristian said, and he's Finnish, so he's of course like so fast, like I don't know why, but his sales cycles are much quicker in respect from his ability to close some of those deals, which is great. And I think that really is a testament to the innovators that his company's working with and our company's working with, that they want to prioritize mental health and really bring these products and services to market quickly. We've had a little bit of a longer journey, and some of the things that you asked earlier about what are some of the barriers that we've seen. What we've seen has been, for the most part, when we go through the beginning clinical pathway, whether it's the chief medical officer or that has to really see what we're doing to make sure that it's clinically sound. And we've always kind of sailed through some of those, that process. And really, it just starts to kind of get a little bit more complex as you start to move into, how do we structure the payment? And then, the real opportunity and the opportunity for coordination. You had mentioned, Steve, that there's always been these bifurcated pathways of either being a vendor or a provider, but we're, Kristian's company, Meru, and our company, Ria Health, we're very similar in the fact that we're a hybrid of those two. So the organizational ability to kind of bridge that gap inside some of the larger health plans, that's building. And so we're kind of a part of that process. But that's been the main thing that I've seen. For the most part, we've had really supportive partnerships, really supportive champions internally that want to be able to bring this accessibility to their members. And that was pre-COVID. Then what Kristian said about the acceleration post-COVID, we've seen a lot of the large health plans that are traditionally very cautious and conservative in the timeline, really wanting to move forward to try to get tools and services to their members' hands during this time of crisis. So we've seen that same acceleration as well.
Well, part of, I think, one of the barriers you've both faced is you've got great products. As I said, they're kind of similar in many ways in terms of the member journey, although one is alcohol and the other one is anxiety and depression. And you've both got great data in terms of demonstrating the efficacy of your program. You've really refined these models. You've got, you're really hitting it out of the ballpark in terms of all the things that you've got right in terms of setting this up. And I often find it's the payers that haven't been ready yet for this level of innovation. And in some cases, it's the payers because they don't know they can't do a bundled payment, they can't do a case rate yet. Claims, you're always doing one-off kinds of workarounds to accommodate claims platforms. I think, Tom, in your case, we probably have half a dozen payment models now that we've put out there for payers as to here's how you might be able to do this. And Kristian, you're kind of catching up to that half dozen at this point as well, because you end up with these one-off kinds of workarounds for payer claims platforms. But we've also been, I think, finding a bit of an evolution within these payers in which historically they had like these product innovation people who were charged with vetting and bringing on board these new technologies. And the network people really weren't part of that process, right? But and so you had this whole long vendor solution kind of a vetting and onboarding kind of a process. But when we're talking about getting your companies on as a clinical network provider, there's a whole bunch of other people within the organization that have to figure out how to get educated about these new technologies, how to figure out how to bring it on board. And sometimes we see those innovation people, the product people, the venture arms kind of facilitating that process. At other times, I find that they're kind of inhibiting that process and sometimes even creating barriers to innovation because they're so used to contracting with a small portfolio of solution vendors rather than thinking about how companies like yours can really transform their entire network, their delivery system. Is that something you've experienced, as well as we've been going through this journey with the payers? Kristian?
A question for me? Oh, Kristian,
yeah. Oh, Kristian.
Yeah. So yeah, totally. I mean, like that's some good points and reflections there, Steve. Appreciate it. So we've definitely seen that there's some of the innovation units can have their own agendas and their own roadmaps, and that's all fine. I mean, like I totally understand that they're coming at it from a different perspective. But I mean, like we've seen the biggest success in working with the clinical people, like the chief medical officers and like other clinicians, medical directors in behavioral health, and then kind of getting to know the network people through there usually. And I would say that that's probably been the best kind of a template for us on how to get to the right kinds of discussions with these people.
Mm-hmm. Tom, any thoughts? Anything you want to add?
Yeah. I mean, I think that there's I think the evolution of this digital health trend for 12 years, I think it probably made sense to have smaller groups that were product focused kind of lead some of these initiatives to make sure that these solutions that were primarily early on, mostly technology, because there wasn't the technology enabled service started to come in the last few years. And so I think that it makes sense that that's where this, the evolutionary journey of, starting in that kind of blue box innovation team within a large organization and then commercializing some of these opportunities and some not working, but very good and valuable experiments. But today, I think what we're seeing is if you just listen to the self-insured employers and you start listening to, these large groups of people that are partnering with the health plans as ASOs, what they're saying is in certain key areas, they've definitely spent a good amount of time looking at, some of the opportunities to help improve the health and well-being of their members, specifically around, mental health and behavioral health. And, I know for Kristian's company, when you look at employers that have employees that are under the age of 35 and a significant, population, they're going to have, a higher rate of depression or anxiety that they're treating. They're going to want to be able to have these services, meet them where they are. They're digital natives. And so I think, we kind of miss that sometimes, that this population group is really starting to come through in a significant way. The employers are paying attention to it. But I guess if you're managing a fully insured, covered population, there's such a span that you may not see that trend and prioritize it so that it goes into the, goes from the blue box to the main organization. And so I think what we're seeing is that that's starting to happen in a couple of real leading innovative health plans where they really have prioritized that. And you could look at the strategic imperatives that the CEOs of those organizations are communicating. And this is where you could see who's really making this, a priority in their organizations. And so we've been lucky to partner with organizations that have done this, and it's reflected in the champions that they have inside their company, moving from a small blue box of innovation into the wider organization.
Mm-hmm. Kristian, anything you wanted to add to that? You've done a lot of work with employers as a potential pathway to payers.
Yeah, that's a good point. So we've definitely seen also that if we've had some strong like Fortune 100 employer partners as well, and we've initially done some piloting and been successful there. What we've then seen is that they have tremendous influence over the different payers or health plans or TPAs, and we've seen that them requesting that, hey, there's someone called Meru here, I'd love you to kind of take a look and review them. Then that has made a huge difference in many occasions for us as well. So that's a good kind of a strategy also to work with the employers, and once you're able to add value, then they're typically quite eager to help you out with the health plans as well.
Mm-hmm. Well, the other area I find employers are helpful is once you've got that contract, driving utilization. Figuring out how, one of the barriers I've seen where I hear from the payers is that some of at least the early generation virtual solutions didn't get a whole lot of utilization. So when you think about member engagement, employers can be a big part of helping get you access to their membership. Tom, what are you doing in that regard in terms of employers and thinking about driving engagement with members and member acquisition kinds of stuff?
Yeah, so Steve, we're focused on a condition that affects 20 million adults in the United States, alcohol use disorder, and yet only 4% of the people with this condition will seek some sort of specialty care throughout the year. So you have a population of 96% being untreated. And now, if I said to you I had the cure for diabetes and it's going to resonate with 4% of the population, you'd laugh me out of your office and say, come back when you figure this out. So when when we showed up with a program that is based upon evidence, and it is centered around harm reduction and empowerment, uses medication to help people reduce the cravings, just the simple fact of saying that there's a way to help you reduce the cravings for alcohol misuse using medication. About 75% of the people that are struggling with this don't even know that. They don't even know that. So a simple communication really takes on a whole new level of awareness building within large organizations. And so what we've been doing is, in a very compliant way, we've been working with our health plan partners as well as employers to structure and execute multi-channel awareness building campaigns that bring value through content, through interactive polls and surveys that will help people understand more about alcohol misuse. But we do it in the context where it talks about the broader mental health opportunity. There's so many organizations, and Kristian, you're a leader in this space, and there's so many organizations that are really embracing NAMI and other groups to talk about destigmatizing the conversation around mental health. And the last 30 years, people have benefited from the investments that large pharmaceutical companies have made to destigmatizing depression and anxiety. We're just at the beginning of that around alcohol misuse and substance misuse in general. And so it's a really great opportunity for employers that have embraced innovation on mental health to include substance use disorder and have the alcohol message separate from the opioid message to be able to resonate with that person, but to talk to them in a non-judgmental and non-stigmatizing manner. And then we do that through marketing programs that are involved in direct mail, email, text message, and every kind of modality you can think of.
Yeah, we first started working together. I was wondering, there's been so much emphasis on opioids over the last several years. It's kind of taken all the air out of the room. I was wondering what the interest level would be with alcohol, and I think we were both very pleased to find out that, yeah, they do get it. They understand that it's a bigger issue in many ways for them than opioids. When you think about this from a population health perspective, where do you fit in, do you think, Kristian, with Meru? Population health, collaborative care, themes like that.
Yeah, so we've actually done we see ourselves fitting into like a couple of different areas. So we've done some very successful collaborations with primary care clinic networks, with on-site clinics, where we've definitely done collaborative care, getting PCPs collaborate with our clinics so that people get referred to us, and we can then loop back and keep the PCPs in the loop on what's going on. So that's definitely been something which has been very successful. And we also see that a lot of the PCPs are like, especially in these times, they're really struggling in being able to deal with all the patient flow of people with depression, anxiety, and burnout. Mm-hmm. And then that's been kind of a great way to collaborate with sort of like a collaborative care model where we do that with them. But then what we're also seeing is that I guess like one thing as a provider, like Tom and Ria as well, that they're a provider as well, we've seen that it actually has made a tremendous difference, be a provider versus be a quote unquote tech company. Mm-hmm. And what that means is that when we communicate to either people who come from, PCPs as referrals, or who we reach out, like Tom mentioned, we also do similar like reach out campaigns and customized campaigns for our employer population. So we're seeing that it makes a whole lot of difference on if people know and can trust more that, hey, that's a provider that's now kind of reaching out to me. I'm kind of, engaging with a provider versus like a kind of a technology company. So that's been like a really big thing also, to clearly communicate that we are a provider and regulated by all the different state laws and medical boards and so on.
Right. Yeah, one of the biggest challenges of scaling is all those licensing and all these different places, and having your providers across the nation. Well, you've had similar kinds of PCP kinds of interactions around things like experts, and how a virtual solution like RIA could be helpful with experts. Docs often don't like to do experts because they don't know where to refer people. You have a solution.
So the opportunity that we've been working on developing from a referral channel perspective aligns on, when people are going into their annual physicals, and most primary care physicians are supposed to say, ask them what their consumption patterns have been, and not a lot of them do it. And the main reason is, if somebody answers in a way where they now have to do something, they kind of sometimes don't know the right thing to offer that person. So that's the unmet need that some of our health plan partners have asked us to focus on. And a lot of health systems that we've talked to, they've been, they've implemented Expert, they've got it system-wide, it's being done, but they're lacking in options. So, one of the things that's super critical for many people is choice. And so, if I walked into my Kaiser facility and I said, hey, I answered those questions and I scored, in a place where they needed to do something, the only choice is going to be that program that Kaiser has, which is a fantastic program. The only challenge is it takes 15 hours a week. And I'm a single mom and I'm taking care of my family and working. I don't have that kind of time. So the place where we have the opportunity in building out the referral channels with our health plan partners is by taking the tools and technologies that we have as a core competency, understanding this unique condition. But when that consumer comes through and that provider has to give them some insight, choice, making sure that it's not just one provider. Here's your residential option, here's your in-person treatment option, here's your telehealth option, and here's your free community-based option. Like, having choice is super, super important. And that's what we're building out in our referral efforts.
Mm-hmm. Well, and I think that's one of the weaknesses of that traditional managed care company, kind of a vendor's kind of a toolkit. It's, we have one type of provider doing this, another one doing that, whereas you really want your members to have choice. There's, no outfit fits everybody. So you need to be able to give your membership choice. I think that's what I'm starting to see some MCOs turn a corner on. Kristian, do you want to add anything to that thought?
Yeah, I mean, like, I guess that, like, from our perspective, what we've seen that, like, the members, like patients, are consumers, like in the same way as in any other domain. I mean, and we should also treat them as consumers, and like I said, give people choice. And some people will prefer, we know it from other research as well, that some people still prefer face-to-face and brick and mortar, but now, obviously, like with COVID and everything, things are changing maybe faster than ever before, and more people are opening up to the options like telehealth or even like digital experiences. So that's there's a big shift happening now.
Mm-hmm. So as we kind of start to move towards coming out of shelter in place and revisiting communities in ways that we haven't for some time now, what do you see happening, and how are you positioning yourselves? Tom?
Wow. So, I mean, just personally, I went to the dentist my second time last week, and the first time I talked to you guys about it a couple of weeks ago. I think my wife must want me to have something because she made the appointment, but I went, and it was really traumatic. I'm not going to tell you that I was comfortable. I felt incredibly uncomfortable. And then I went back for some more work, but I had a lot of empathy for my dentist because obviously his business has been so negatively impacted, and he's essentially a frontline worker there helping people like me take care of our teeth. So for me, I think psychologically, it's going to take a long time for people to change what has just become, a trauma-induced habit, which is, oh my God, I don't want to touch that person. I don't want to be around that person. So we're going to see this for a very long time. The flip side of that, what we have seen in, quite frankly, the last 5 to 6 weeks, and this is an increase of more than 300% in people coming to look for help. And this has been, this is significant. We're talking tens of thousands of people. And we were already doing very well with awareness building. And this is just, something that's blowing us away. So we're seeing just a huge increase. And I think because, traditional providers that have to pivot towards telehealth delivery, they're going to need some time to get those quality processes in place to be compliant. So it's going to be a little bit of a shaky ground for them. And so we heard from some people that had tried something that wasn't that tight or when it wasn't that, nailed down. And, we've been doing this for 4 years, and, and Kristian and his team have done this from day one to be able to deliver this program at a high quality and a comprehensive way virtually, and most of all being safe. We got the Joint Commission accreditation because of that. And so I think it's really critical to see how we're going to embrace people's, psychological requirements when it comes to a healthcare interaction for the next 24 months. And I do think that the trend around telehealth delivered services is going to, consistently keep growing.
Yeah. Kristian, any final thoughts from you?
Yeah, definitely. Like seconding Tom there again, I mean, like it's definitely impacting our society and our habits and our kind of like how we behave, in different healthcare settings, definitely, I think for good in many ways. And some people are coming back now more like kind of going back to brick and mortar, but then, definitely we've also seen a huge uptick and a lot of people exploring and just like coming to us with questions and asking and like seeing and kind of getting to know like what if I'll give this a try. And I think that's very, very positive. And services like ours and like Ria Health, we can offer people care which is there when they need it. So the cool thing about digital that people don't necessarily always think about is that actually it can be very personal. It can be very caring. Like we are typically interacting with our patients on a daily to bi-daily basis. And it, can be sometimes very short interactions, but there's someone there for you. It's all about caring and creating that relationship.
Right. Yeah. People need that kind of multiple touch kind of an interaction all the more these days than they have in the past even. Tom, any final quick thoughts?
Yeah, no, I think first and foremost for people that are in the early stages of getting their company off the ground and their service off the ground, it was the best thing we ever did was to kind of go and get our data built first, get the outcome data first. And then the second thing is to really align yourself with advisors that are going to bring the deficit of skills that you may have in this pursuit, because this is a marathon, experience and not a sprint. And so you're going to need those like incredible coaches to come in and help your company. And we've been really lucky, that's how I got to know Steve. And there's a few other people, David Batchelor, who was the former chairman of Marsh. Having these people come in and give us education around really, incredibly complicated nuances in some of these industries has been, just amazing. So I think if you're in an early stage business, that's the thing to kind of focus on quickly. And then for the health plan partners that are listening out there, we're really grateful for the opportunities that so many people have given us. And we would encourage that you look not just at Meru and RIA, but all the companies that have been able to move through that data validation, the validation by other payers to start to give them some momentum. It's one of those things where without that support, you can't make it. And so your investors are not going to be as patient, even though it's healthcare investors, they understand it's a long cycle. So they need to have that support from their health plan partners. So I think collectively we can do a lot of good for so many humans in this time of crisis.
Mm-hmm. Good. Well, thanks both of you for all the work that you're doing at Meru and at RIA to help improve the behavioral health delivery system for people, especially in this time of need. And thanks again for talking today.
Thank you,
Great.
Steve.
Thank you, Steve. Thank you, Kristian.
Okay.
Take care,
Thank you,
everybody.
Tom.